Hi again, and welcome back for your Dr. Fauci-inspired gain of function exercise for the week. This week we're going to restore mobility to the rib cage and the upper spine, and we're going to add some shoulder blade stabilization from the back as well. Some of the muscles we'll be using are the obliques of the trunk, the middle traps and rhomboids in the back, and all of the supporting muscles around the shoulder blade. Many other supporting muscles are going to be pulled into this exercise. What we're looking for here is more mobility and rotation in the rib cage and the upper back, and while also unloading that tight and many times painful front of the shoulder by using the back of the shoulder to assist with rotation of the trunk and the spine. What you'll also experience with this exercise is how shoulder position affects your ability to rotate the spine and the rib cage. My hand placement here significantly changes the position of the shoulder and the shoulder blade, and this will dramatically alter the neuromuscular integration of your ability to control motion throughout the upper body. Play with these different positions and find out what your body is telling you about what it needs. So here's your thoracic spine, rib cage, and posterior shoulder exercise. There's a lot going on here. Begin by laying on either side and pulling both knees up toward the belly to at least waist height. You can see I could probably pull my knees a little higher in this position. This position tightens up all of the connective tissue of the lower back so that the upper back and the rib cage and spine are better targeted. To begin, lace your hands behind your head so that you can so that your head and your neck are fully supported. You can play with any of these shoulder positions later, but start out with your hands behind your head. Take a deep breath in through the nose, fill the belly with a diaphragmatic breath. Then, using your breath as your guide, begin to reach back toward the floor with the top shoulder as you exhale. So as you're reaching back, as that shoulder rotates toward the floor, that's when you exhale. As you begin to rotate or twist toward the wall behind you, toward the floor behind you, gently squeeze the back of the top of your shoulder toward midline. Gently squeeze the back of your top shoulder toward midline. And gently press the elbow of the bottom arm into the floor. So this arm right here, I want you to actually engage that bottom arm. Press that bottom arm into the floor as you reach back toward the floor behind you. You should feel both shoulder blades squeeze gently toward the midline. Do not strain. This is not a strengthening exercise. Take what your body gives you and stop the motion at the end of your exhale. Inhale and return to the starting position, then repeat. There's no need to hold any portion of this exercise. Keep moving and find a rhythm. Perform about 10 repetitions on the side that is more challenging, then switch sides and perform 10 more, and then switch back to the side that is more difficult and perform another 10 repetitions. This should be a relaxing exercise that is free of exertion and pain. Perform this exercise for about 10 repetitions, 3 sets, with 2 of those sets being on the side that's more difficult. So what's the regional movement health connection here? The shoulders can be overworked if the upper back and ribcage have lost their ability to move. So restoring that mobility and integrating shoulder neuromuscular control, especially at the shoulder blade, is critical if you want to unload the shoulders and allow the tense shoulder muscles to relax around the head and the neck area as well. You might be experiencing pain and tightness in the front of the shoulders due to all that time you're sitting in front of your desk. So think about all the times that you spend reaching for that keyboard and mouse in a slumped posture, causing you to round your back and extend your neck. Your shoulders get pulled forward, which causes them to lose support from the muscles on the back of the shoulder. The result of this is that if your chest, neck, or shoulders become tight, it's going to create a great situation for an overuse injury to occur just from this position alone. So stiffness begins to take hold in the rib cage and upper back, and you begin to get stuck in a rounded position, which leads to muscle spasticity, fatigue, and even headaches with activities that require upright posture. So this is going to lead to early fatigue with activities such as hiking, biking, running, and other sports as well. What you can see here is that if the shoulders or upper back become stiff and painful for no apparent reason, that's a warning light that's telling you to take a closer look before you begin to experience a regional loss of function. And that loss of function can lead to movement compensation and eventually injury. Again, keep in mind this exercise is just one of a piece of a larger recovery picture, and that by itself, this is not a long-term solution for significant shoulder, ribcage, and spinal dysfunction. If you'd like to learn more about better movement and how your trunk motion is related to shoulder, spine, and even neck pain, then your first step is to make sure that you get an accurate diagnosis, a clear picture of how the entire region works together, so that you can begin to experience gain of function as well. Click the schedule button. Let's make sure you're not wasting your time practicing exercises that are not going to help. Thanks for watching. I'll see you here again soon.